Brain stroke is something that I've seen like 1 or 2 times in the hospital settings, or what I've seen like 1 or 2 patients that have experienced this, and this is quite dangerous. This is quite painful. This is quite terrible. In fact, during my time in the hospital, I've experienced patients who had these complications, and a lot of us feel that stroke is a common thing. Stroke is something that is mostly associated with the cardiovascular system, and it happens as a result of blood not being able to reach some particular parts of the body. And when it happens in the face, it means the blood could not supply to the face, or either the brain that controls the nervous part of these areas is no longer functioning, and it's as a result of the brain not being supplied with enough blood for it to be able to function and navigate all other nerves in the body. So another word for this brain stroke is known as demon face syndrome. This is quite terrible, and I would advise most of us who do not engage in healthy habits that most times result into some of these complications that it is very hard to be reversed, to abstain from some lifestyle that are quite dangerous and are unhealthy, to enable us to live long and have a good life and wait for our offspring, our great-grandchildren, see them and feel fulfilled in life, have a good life that after we are no more, we can be proud that okay, we lived to our old age. So I want you to also watch this video so that you can learn more about the facial stroke.
You've heard the word brain stroke, but do you know what it actually does? Imagine looking at your mother's face and seeing a demon. I'm not joking. This happens. It's called prosopometamorphopsia, also known as demon face syndrome. Patients say faces melt, eyes stretch, mouths twist. Normal humans look monstrous. This isn't madness. This is brain damage. Now understand why. A brain stroke happens when blood supply to part of the brain suddenly stops or a vessel bursts open. No blood means no oxygen. No oxygen means neurons start dying within 3 to 5 minutes. And the brain doesn't fail as one piece, it fails by region. If the stroke hits the visual cortex, the world distorts. If it hits the language center, words disappear. If it hits the facial recognition network, the brain can no longer assemble faces correctly. That's when loved ones turn into nightmares. This isn't theory. The Lancet, one of the world's most respected medical journals, has documented these cases. People survived the stroke, but their reality never came back. And here's the most dangerous part. A stroke doesn't always announce itself with pain. The brain has no pain receptors, so it arrives quietly. A drooping face, a weak arm, a slurred word. High blood pressure slowly thins vessel walls. Diabetes damages blood vessels from the inside. Smoking thickens blood. Stress spikes pressure. Then one day, a clot forms or a vessel ruptures. And inside someone's home, before help arrives, the brain begins erasing itself. Not memories all at once, but pieces, faces, words, reality. A stroke doesn't always kill you. Sometimes it leaves you alive inside a world you no longer recognize.
I'm very sure you must have learned a lot from the video you just watched. And if this video have impacted you, please don't forget to like, share and subscribe, and also watch other videos that are on the channel so that you can learn more about health tips that will help you live a healthy life and strong. Thank you. See you in my next video.